So, who's Dr. Lydia Kilani?
Dr. Lydia Kilani is a general surgeon with a special interest in breast surgery. I did my undergraduate training at the University of Cape Town and my postgraduate training at the University of Witwatersrand, Wits, here in Johannesburg. I've been working in the private and public sector in Johannesburg over the last few years, and I am the founder of Maboneng Center for Women's Health here in RA Hospital.
How can patients contact you?
At Maboneng Center for Women's Health, we're really a contemporary unit where we have our physical space here in the 4th floor of the medical suites at RA Hospital in Kempton Park. You can come in, make an appointment, give us a call to schedule a consultation. But also we're in the virtual space, right? So we've got a website, www.mabonengwomenshealth.co.za, where you can leave us a message, you can read our blog posts on everything female and health related. We're also in the social media space. We have a Facebook page, Maboneng Center for Women's Health, and an Instagram page, also Maboneng Center for Women's Health, and a Twitter page as well. And you can like us, follow us to get really interesting information about women's health and wellness. And we're available to answer any of your questions. You can also email us on info@mabonengwomenshealth.co.za.
What services do you offer?
Here at Maboneng Center for Women's Health, we are a full specialist surgical unit, which means we offer a wide range of general surgical management geared towards the female patient. I could go on and on, but just to name a few, we offer thyroid hormonal management of thyroid disease, breast cancer, from start to finish of your breast cancer treatment involving surgery and other oncological treatments, and non-cancerous breast lesions. We also do a full assessment and management of your GIT issues from reflux disease, stomach ulcers, and another big thing that really affects women is gallstone disease. So we manage your complications of gallstone and gallbladder disease. We also do colon and pelvic floor issues. So screening for colon cancer, surgery for colon cancer, and something that women don't really like to talk about but is actually a big issue is pelvic floor problems that come from years of just strain and multiple pregnancies. Smaller things like lumps and bumps on your bodies we also do, and basically all general surgical conditions can be managed at our center with a uniquely female touch.
I'm sure you get asked this a lot. Doctor, I felt a lump in my breast. What advice do you have for this particular patient?
First thing I want to say is don't freak out. Don't freak out. There are lots of reasons for a breast lump, for women to get lumps. Most of them are completely benign, completely normal, but unfortunately some of them can signify cancer. So the first thing you need to do when you feel a breast lump is come into hospital. Come and see a breast surgeon or a breast center such as Maboneng Center for Women's Health, or go to your GP so that they can also examine you. And the first thing we would do is get a full risk assessment of you as the patient and what your risk is for this lump being cancerous versus non-cancerous. And that's from doing a full clinical examination, getting a full detailed history of your medical, your family history, all of that. Something I want to say that's very important is the only way to really diagnose cancer is 3 things that we do. 1, we examine you, we feel the lump, and we look at you as a whole patient and decide based on your history and what we're finding clinically if this is suspicious. Second thing is we image you. We get a good picture of your breast and this lump, right? There's certain features on the x-ray, on the mammogram that can tell us if this is cancer or not. So we would do a mammogram, we would supplement that with a breast ultrasound, and we would also do an ultrasound of the glands in your armpit, which are linked to your breast. And then we have a discussion if this looks suspicious or not on mammogram. Then the third and final, most important thing that we do to diagnose your breast lump, to see if it's cancer or not, is we do a biopsy. So we need tissue. Under guidance with our sonar machine, we get a small piece of the lump, we send it to the lab, and under a microscope and doing a whole bunch of very sophisticated tests, that will tell us if this is cancer or not. And not only that, but it can also tell us what type of cancer it is. Because cancers have different characteristics. Some are more aggressive than others, some respond to different types of treatments. So we can really characterize your cancer based on laboratory tests that we do. So my advice would be, number one, keep calm and visit a breast surgeon. Keep calm and come into Maboneng Center. Don't freak out. Come as early as possible.
What inspired you to open this center?
You know, being diagnosed with a surgical condition or a cancer is a really daunting and traumatic time in a woman's life. And what I found through all my years of practicing general surgery was there is a need for a place where not only can a woman receive quality surgical care, but her emotional needs, her psychological needs, and all the other things that come along with being a woman can be addressed and met. So for me, the center is very important in the management of female surgical disease. It offers holistic care, which I felt was missing in the practice of general surgery.
Why the name Maboneng?
You know, I get asked that a lot, and some people confuse it with Maboneng Precinct, which is in downtown Johannesburg. Not at all. The reason I chose the name Maboneng is because in Sotho, Maboneng means place of light, the place of light. And that's really what I wanted the center to represent and embody for all our female patients that come in here. I wanted to be a place where women would be treated with dignity and respect. They'll get good quality care that they deserve, and it's a place where they'll really receive quality health care. So yeah, Maboneng Center for Women's Health. It's a center of excellence.